And here is your question. Right, so if you have read and understood considering a surgical pathology station, kindly tell me what are the differential diagnoses you'll consider after reading the stem?
Okay, I will consider septic arthritis of the right knee. I'll consider infected implants.
Okay.
And then also consider osteomyelitis of the bones that form the knee joint.
Yes. How would you confirm your diagnosis?
Yes, to confirm my diagnosis, I want to do history taking and physical examination, and then also do radiological investigation.
Yes.
And then also do a knee arthrocentesis to do a physical examination and send it to the laboratory for microscopic culture and sensitivity.
Very good. Okay. Once you know the diagnosis, can you tell me what management would you suggest for this patient?
Yes, the management that I would suggest, I will want to do for septic arthritis, I want to do knee arthrotomy and washout for him, and then also remove the implant that is in the joint so as to remove the septic focus of that the implants may be in the knee. Then I will give him antibiotics and analgesics, and then we'll commence gradual physiotherapy later.
What is the most common organism which causes infection in the bones?
Staphylococcus aureus.
Okay. What is the treatment of this organism?
The treatment is use of antibiotics, usually for a long time, 4 to 6 weeks in bone and joint infections.
You can say that you'll consider according to the trust policy.
Policy.
Yes. Okay. Right. Can you tell me how the infection spreads?
Okay. Infection.
What is the pathogenesis? Yes.
The infection can spread through hematogenous spread from the blood to the bone. Can also spread from direct. How?
Yes, the pathogenesis. If you can tell me the process.
Okay, if there is infection anywhere in the body, the bloodstream, the microorganism can get into the blood, and then to get carried to the bone. And when it gets into the bone, usually at the metaphyseal part of the bone, there is, because of the slowing of the blood flow at that part, and there is reduced oxygen content, makes the microorganism to get easily attached to the bone there to cause infection. And from that is really going to cause infection, will lead to cell death of the bone cells, and the formation of abscess, which will further cause increase in pressure within the bone, and then cause death of the adjoining bone. Then after death of the adjoining bone, the bone that are dead will form sequestrum, and the body will, and the periosteum will try to form new bone over that dead bone, which is called the involucrum.
Okay. Can you please tell me during this process how the pus is formed and how is it busted out through the bone?
Okay, the pus are formed in the inside the bone, and then they pass through the efficient canal to get into the because those are the areas where there are less pressure. So they pass through those efficient canal, then gets into to elevate the periosteum, to lift the periosteum of the bone. And then they now burst on the soft tissue overlying the bone.
Okay. Right. Sometimes what happens that this infection or this pus keeps on coming. This can alert you, or this can make you watch out for another condition. What can that be?
Osteomyelitis or septic arthritis.
No. This could be leading to a sinus, which can later on develop in
squamous cell carcinoma.
Carcinoma, yes.
Okay.
Another condition that can occur is that this infection leads to a term called necrosis. Can you define the term necrosis and how would you classify it?
Okay, necrosis is when there is a death of cells or in a tissue due to critically insufficient blood flow.
Yes.
The classification could be coagulative necrosis, liquefative necrosis, fat necrosis, and then caseous necrosis.
Okay. How have you classified them?
The classification is based on whether blood flow is affected or not, and whether the infection is affected. The ones for coagulative necrosis, there is an impairment of blood flow. For liquefative, there is infection that is involved, and then for caseous necrosis involves both impairment of blood flow and then infection. And for fast necrosis, you have
necrosis is different from autolysis?
Yes, in autolysis is when there is a death of the cell, or apoptosis.
Yes, or apoptosis.
Okay, apoptosis is a programmed cell death, while necrosis is not a programmed cell death. And apoptosis involves energy dependent, while necrosis doesn't involve energy dependent.
Good.
And then necrosis involves damage to the cell membrane, while apoptosis doesn't damage the cell membrane. While necrosis is usually a pathologic condition, while apoptosis can occur both in physiologic and then pathologic conditions.
Considering infection of the bone, which type of necrosis is common?
The type of necrosis that is common in bone is the liquefative and necrosis. Caseous necrosis can occur in tuberculous infection of the bones.
Okay, right. You said there could also be removal of the plate or the fixing plate,
Yes.
knee plate. Yes, why is that so?
Because the plate is going to serve as a septic focus for infection. So for me to be able to get rid of the infection, I need to remove the implant.
Okay,
so that
good.
It won't serve as a nidus or a place where the bacteria will be hiding.
What should be the ideal management or treatment of infection of the bone or osteomyelitis?
The management is multidisciplinary, use of antibiotics.
Yes, and
good nutrition, and some of them may also require I&D for abscess, and then sequestrectomy for any dead bone that is that has formed, and then nutritional rehabilitation of the patient, and treatment of any underlying condition that may make the patient to have immunosuppression.
And maybe a sport like splintage of the limbs and pain removers, painkillers, etc. Good. Good. Thank you.
Thank you. Madam, this case may be septic arthritis, because this picture diagnosis can be septic arthritis.
Yes, but you have to think, it cannot be one of the differential can be septic, but not the provisional, because knee plate was inserted or placed 3 years ago, and or maybe many years ago. In this one, I have said 3, but could be many years ago. But once there is history of trauma and there is knee plate, then osteomyelitis is the most likely provisional diagnosis.
Because he present with 1 week history. So maybe septic arthritis, maybe osteomyelitis. And in this case, the investigation is joint aspiration.
Yes, yes,
It is also included.
it should be also included. Yes,
And
pain
he,
and fever, yes. I have written yes 1 week, but that's when it became too much and patient noticed and came for advice.
and he told bone necrosis, liquefatic necrosis, which type of, I
Can
think it
also
is.
be then the coagulative one, and then this one can also occur because it
Okay.
causes ischemia, and because of ischemia, this can occur.
Liquefactive is in the brain, madam, I think so,
It's brain.
but it is not in bone.
Okay,
No,
all right,
but the
thank you.
bones of the skull maybe.
Okay.
But here it was like we were talking about the knee, so yeah, that would have been more logical to tell me the other one. Good, thank you.